I want to start because, like I said, Lisa, I've been a fan and a supporter and a buyer of your products. Share a little bit about this journey and what brought you to this moment about like expanding the work that you've already done outside of being an entrepreneur to support Black women.
Well, being a Black female entrepreneur who's been one for 30 years now, there's always just being who I am. I'm put in the place of supporting, uplifting, and echoing the voices of my sisters. And because if I help make her life better, I'm helping to make my life better, and I'm helping to make the lives of our children and grandchildren better. What has been remarkable with the project that Latham and I have been able to form is to be in a place within the brand that you have the luxury of the time to devote to a cause about which you're passionate, to support your sister who, you know, this is her calling, and this is what she does day in and day out, and to be able to be a cushion for her to lean on, an arm for her to hold on to as she's going through and doing her work, and amplifying that message and bringing it within the larger corporation of L'Oreal that understands the importance of this for our community, but also understands the importance of it for the consumers of Carol's daughter, and then for Carol's daughter herself. It was just a perfect timing for all of this to come together. And I'll also say that internally, everyone who works on this within our team very rarely refers to it as work, because everyone has their own stories, their own birth stories, or stories of family members. And to do anything to improve that is what we all sign up for every day in our partnership with Mama Glow, which is called Love Delivered.
Yeah. And I would have to say, when you said, because Carol's daughter, right? Like, I am the great-granddaughter of Carol Lee Dickens, the granddaughter of Marie Mansfield, and the daughter of Dolores Morgan Carr. It is about the love of a daughter and a mother. I think that brings you to, you know, I love the name, like Loved Deliver. So Latham, you've been doing this work forever. Share a little bit about, you know, there's a growing conversation around Black women's maternal health. Some of that is because we've elected women, right, like a Lauren Underwood and others that are carrying the importance in sharing the stories about Black women that we already know. So share a little bit about this journey and what we can do. I mean, there's no reason. I think the most high-profile story right now is the Olympic star Tori Bowie, who just died trying to deliver her baby. What is it about this moment, and what do we need to do as Black women and those who love us and support us in this moment?
I'm going to try to answer all three of your questions. And first of all, thank you so much for having us, and thank you for having this important conversation, because we are all here because someone was brave enough to give birth to us, right? And birth is sacred, and what Lisa and I hold inside of this work is that while we are looking at the staggering and disheartening and really depressing maternal health statistics that we see impacting our community, and just to frame it for folks who may not be as familiar, in the United States, Black women are 4 to 5 times more likely to die during childbirth or due to childbirth-related causes in comparison to their white counterparts. And this is without taking into account the fact that you might have a white woman who only has a high school education and she has a better health outcome than a Black woman who has a postdoctorate degree. And so what this means is that we know that education and financial resources and economic mobility and where you live and your zip code and the hospital you've access to and the insurance that you have may not matter. And we know that baked into the system, as Dr. Crenshaw was saying, is systemic racism, and intersectionality and health outcomes actually does impact Black women. And so when we think about what this means for us, when people think about that information, it actually can make people feel like there's nothing that they can do, right? Because they think something's wrong with us. And I want you to know that it's not something wrong with us. It is not our race, it's racism that's the problem, right? It is not something that's inherently wrong with Black people or Black women, because oftentimes we're blamed, and that's exactly what we see happening with Tori Bowie's story. Oh, she should have done this, how come this, right? There's always blame. And it's not our fault. But what we can do is there's lots of pathways, including our electeds. And one thing that we're really proud of is the Black Maternal Health Omnibus Act, which was just reintroduced in May. And you mentioned Representative Underwood and Alma Adams, and then Senator Cory Booker, who worked together with the Black Maternal Health Caucus to structure the most comprehensive package of maternal health legislation that we've ever seen in this country. And it had to be introduced 3 times. You know why? Because people don't care about our health outcomes. If this was white men, we wouldn't even be talking about it because it would be fixed. By the way, we wouldn't even know about it because it wouldn't have been a problem on our radar, right? And so we need to also become health literate, right? We're talking about health literacy. We're talking about advocacy tools, being able to, even if you're a non-birthing individual, even if you don't have a uterus, even if wherever you are in the continuum, it's a human rights issue. It's not a Black issue. It's not a Black woman's issue. It's a human rights issue. Say it's a human rights issue. And so we need to come together as a community to wrap around services and support and resources for Black women and birthing individuals, as well as our partners and dads. Like Black men need to have a voice in this space as well, because they are losing their wives. They are not feeling like they can advocate in spaces where we're impacted. So I think that part of what we're doing, at Mama Glow, before, we connected with Carol's daughter, like Lisa and I have been friends for a very long time. And so it was always this idea of like, how can we come together to lift up the work that we were already doing? But another piece of it, and I know we're going to talk about Love Delivered specifically, but another piece of it that I think is really important is education. And we're talking about this attack on education. Dr. Crenshaw was talking about it. It is real. And I'm in the university. I'm a professor at Brown, where I'm a professor of gender and sexuality studies. And our doula training is embedded at Brown University as a course, and it's the first and only in the nation, and also in the Ivy League to exist. But the reason for that is because I get to interface with people who look just like us in the room, who are bioethics students, medical anthropologists, OB-GYN, public health, people who are going to be people who are going pre-med, and people who are in medical school, who are going to change the course and the culture of our current medical model, who are going to be the chiefs of the hospitals and the heads of OB, right? And so we need to pour into the young people who are going to help shift the culture forward as well. And so I think that it's like a multi-pronged strategy, looking at electeds, because we do need people to push this through. We also need to look to education. Our institutions are, as you said earlier, like designed to fail us. And so we actually have to be the ones to imagine a new design, right? And to redesign them ourselves.
So you mentioned this, the importance of Black elected women. I will bring into the room that, our Vice President Kamala Harris hosted a summit at the White House on Black maternal health. First time ever that conversation, I'm sure, was centered with bringing Black legislators and advocates into the White House. Our states are under attack, and our state legislators, like New York State Senator Leah Webb, and those across the country, are fighting to ensure that our voices and our experiences and stories stay on the table as they advance public policy. So share a little bit about Love Delivered, how we can connect. What does the next 12 months look like for the program, and what is the biggest need in this moment to ensure that we help to grow Love Delivered?
I'm gonna have Lisa start, and then I want to talk about like the 12 months and all the impact, but I want Lisa to start first because love is in the title. And so I want her to first share, how we actually came up with doing this, especially because it was born in the pandemic, just to really illustrate the power of two people, by the way, and then what it looks like in extension when we bring people to live into the vision. So I want to have her go first.
Okay, so I'll try to do this quickly because then Latham's part is also so very important. I had been being courted to be in the maternal health space, but not necessarily the Black maternal health space. And while the organization that was courting me to be a part of them was great, it just didn't really hit me where I wanted to feel it. I didn't feel like I was going to have the impact that I wanted to have. And during the pandemic, I discovered that you could leave audio messages on people's phones versus just sending a text. And I just love this feature because sometimes when you type words, someone can't hear your intention. So if you hear my voice, then you really know how I feel. And you know, during that time, you never knew if someone was healthy or sick or whatever. So I just wasn't randomly calling anybody, even though I'm old enough to do that. You know, yes. I'm old enough to still pick up the phone and call you. So I sent audio messages to Latham, like, is there anybody else that's doing this? Because I want to be a part of this, but this is just not the right space for me. And it turned out that she was in the process of being an organization that could be that thing. And, you know, so we exchanged audio messages back and forth. We walked in Brooklyn, you know, with our masks on, and we talked and literally, you know, planted this seed and gave birth to this baby, Love Delivered, in 2021. And what, you know, I already said how excited the team was to work on it. But what we were thinking, honestly, if one person's birth outcome could be better, the ripple effect that that has. Because I had a birth story for my first and somewhat for my second, because my second was impacted by the first. It wasn't negative in the sense of I was sick or I almost lost my life or I lost my baby, but it wasn't what it should have been. It wasn't respectful. My husband wasn't respected. Like, he was actually asked, who are you and what are you doing here? And I'm like, I'm in labor. Like, isn't it obvious that he would have a vested interest to be in this room? And mind you, I was there for 72 hours. So, like, I think he's somebody that I know. So I can't even imagine if something had gone terribly wrong, what that experience would have been like. And because that situation didn't turn out the way that I wanted, I didn't have the best outlook the second time around. I didn't feel like I could advocate. I had the honor of being able to have a doula in the room with me part of the time because she pretended she was my sister. And then I had a postpartum doula that helped me with nursing, and I consider myself to be a champion nurser because firstborn, 3 years and 3 months, secondborn, 4 years and 3 months, and tandem, which means both of them, for 17 months. And that postpartum doula is why that happened. And it, for me, reframed my experience of giving birth and being a mother because I felt like I failed them because I didn't have the birth I wanted. So if I can just change one person's story to give them that power, to remind them the power, because no one talks about the power that we have as women to do that job. And no discredit to men, because like Latham was saying, there's a conversation for the men as well, because no one tells you what to do when you're in that space and you feel helpless and alone and you can't ease her pain. But when a doula comes into the space and Mama Glow trains people to be doulas and provides families with doulas, when a doula comes into the space, the doula can advocate for you and your partner. And the doula can let dad know what he can do. And it gives him something to do to support his partner. Because, I'm sorry, the hospital system doesn't give you a role. They act like you shouldn't be there. And usually when men are in a space where their partner is in distress, they want to fix it. And then how do you fix it? How many black men are afraid to speak in their natural voice? when they're in certain environments because they're Black men in America. No one takes that into consideration. And that's why this ability to provide families with doulas and to train doulas to help these outcomes be different and to change these stories and to facilitate the process, it's a small part of a lot of work that has to be done, but it's very, very important.
Yeah, thank you for that, Lisa. And you see what I mean about the love, right? I nursed also for 3 years, and it was because my mom was there as well, and having that support is critical. We need community. We birth in community. And so the work really is about being swaddled in love, right? Having the support and resources that you need. So one of the things I want to highlight before I talk about, like, you know, the shape of the program is that a key factor in the ability for organizations to grow or to do impactful work is the money, right? And there's so many impediments to us being able to access funding that allows us to do the work that we do. And many of us who have nonprofits, ours was, well, I've been in women's health for over 2 decades, but then in my company was 10 years old, and then this foundation was new. And so it didn't have the footprint or the pedigree that the company has. It was riding off of the success of our global organization. And so talking to a company that's global like L'Oreal, right? And having people go through a diligence process with you and be patient because you don't have the financials to show for the last 10 years, or you don't have like all the things that would actually like eliminate you from a process to be onboarded as an organization to work with. They were actually really gentle with us and actually like bypassed a bunch of things to make sure that we could onboard, because we weren't the size at that time that we could have actually been to get on board. And it was because of Lisa, it was because of her team in Paris and her team in the United States that worked to say, like, you know, they have a track record as an organization and we love them and we love the work, so we're going to make this happen. And what that also does is it also helps to build the, you know, the credibility that people want to see for other organizations and other partners that we have that are corporate partners that saw that and we're like, oh, like, you know, they work with them like we could work with them. And so taking that risk is really important. And so for corporate, you know, partners to think through how they can reduce barriers of entry for organizations and even individuals who are doing impactful work in community is critical, because so many of us get doors shut on us. And I want to say that first, because there are people doing work in this room right now who are locked out of funding. And so I just want to applaud also the efforts of Carol's daughter in ensuring that that wasn't an impediment for us, right? So, the program itself, we're in the 3rd year of the partnership with Love Delivered. It's been really beautiful. The first year was focused on really raising awareness. And one of the conversations we had with the communications team on the phone, they were like, okay, we want to reach a bunch of people. We're like, oh yeah, how many? Like 10,000? They're like, no, like 200 million. We're like, oh. How are we going to do that, right? And we're really proud to say that our first awareness campaign reached over 288 million people. And so that was huge. So I was like, oh, okay, I see what you're talking about now, right? And which was amazing because we were sort of using this opportunity during the pandemic while there was so much of an upswell around, you know, Black Lives Matter and the movement for Black lives, which started to also trickle down to maternal health. We were able to see a lot of people's storytelling and then the content that we were putting out and the conversations that we were helping to uplift in the educational spaces that we were holding was, you know, helping people to wrap their head around the information more, make it more palatable and even digestible for folks. Into the year 2, we implemented the program in 5 major U.S. cities. And so that went from New York, LA, Atlanta, Miami, and DC. And we announced it during the first White House Maternal Health Day of Action in 2021. And this year, and so through that time, as Lisa was saying, we were able to, through the partnership, Carol's Daughter directly funds the services, which means that doulas are getting paid for the work that they do, and the families get to access a doula pro bono. And there is no barrier, right? There's no like, oh, what's your income? Oh, fill out this. What's your social security number, your panty size? Like none of that, right? Just what's your name, your email address, your phone number so we can call you and hook you up, girl, right? No barrier. Are you a Black woman that needs a support? We're here, right? And so, because we have to always prove ourselves, and we don't need to. We do not need to prove our humanity or our existence or that we matter. We deserve the support, period. Say period. Right, we deserve the support, period. And so that's what we wanted to do also, was like lift the barrier of entry so that Black women can access these services with more ease. And we're also really proud to say that this year at Essence Fest, we were able to announce a commitment from Carol's Daughter to support families in the NOLA and Baton Rouge region. So now people can apply starting this July for services through Love Delivered. Those services are provided by Mama Glow trained doulas who are in this community, people that look like folks here, who are from your community, and who can support you with those services. And so to me, what this looks like as we think about waiting for legislation to catch up, waiting for policy to catch up, which we work on a lot as well, thinking about reimbursement for doulas and, insurance coverage, thinking about paid, a thriving wage, because I don't like living wage. Like, I'm not trying to just live. I'm trying to thrive up in here, right? So we need a thriving wage for our care workers, right, who are on the front lines. And so while we wait for all of that to solidify, and by the way, once the Black Maternal Health Omnibus gets passed, it will be codified, so there will be money for communities to resource, right, which will be huge. So this is on the federal agenda, and when it has passed, it will be impactful. But while we wait, right, and not wait like idly, but while we wait in action, we need to work with corporate partners to help facilitate resourcing to fill in those gaps, because there are gaps, right? And so I think this is how we do it. It's like a multi-pronged approach, right? It's like, being active, on the legislative front, on the policy front, in communities, right? And it is making sure that you're aware of the issues so that you can advocate, because we all have to advocate for ourselves. We have to speak up, and we have to understand that like on a local level, which was mentioned earlier, like our hospitals, like which hospitals get funding. There are hospitals that are underperforming because they're under resourced. They don't have enough money. They get shut down because they get low rates, because they have high maternal mortality rates, because they don't even have qualified physicians for specialties like emergency care, NICU, things like this, right? Premature birth, or also people who have things like postpartum hemorrhage, right? And so, but then there's hospitals that are huge, that are well-funded, that support white communities only, that kill us too. And they don't get their funding taken away. Right? And so we need to understand, like, what does it look like to actively be engaged in a conversation and designing a space and a center really that is going to ground us in solution for our own health outcomes. And that also means understanding what's available to you, not just the hospital, out of hospital birth if you are low risk, home birth if you are low risk, birth centers if you are low risk, because the people who are doing this work look like us. The people who birthed this nation were our foremothers, our ancestors. We were carried through the Middle Passage, born in the darkness, and arrive here with this wisdom. And these wisdom traditions were put into institutions. That information was taken from our grand midwives, put into institutional settings, and we were locked out of that information generationally. So some of us have lineages that connect to midwives, right? Connect to birth workers and care workers. And we were locked out of that institutionally and locked out of it educationally. And so now when you look to see who are the doctors and who are the nurses and then who are the people who work administratively, we're all overrepresented in administration. We're overrepresented in nursing. We are not overrepresented in physicians, right? Less than 2% of the physician population is Black women. Less than 2%. And so just so you know how many OBGYNs, we have 37,000 in this country. Less than 2% are Black. At the beginning of this nation, everybody was born by a Black or indigenous midwife. Everybody was born by a Black or indigenous midwife. And so now we have 14,000 midwives in this country. So that's a gross imbalance, right? 37,000 to 14. And of that 14,000, 6% identify as people of color and less than 2% are Black. So we need to shift it. So education is a pathway, policy is a pathway. We need to ensure that we make it so that we can access this care. Because right now we cannot access it. If you wanted to have a midwife, the chances are that you might not be able to. And in some places in the South, it's still illegal. And so there's a lot of work to do. And so what I think for me and Lisa coming together, it was like, what is a part from the resources that we have and the work that we are doing that we can come together and make it possible that people can get access to services and support? Because we know we can do that, right? And so it's about knowing what you can do. What do you have the capacity for? What wasn't that asked earlier? What can I do? I think Cori Bush was saying this, right? That we all can do more. Right? And so it's on a Sunday. I'm going to ask you to insource from within and pull from yourself the resources, right, to support each other because we can do it. And the solution is here. It ain't outside. It ain't going to be no white folks. Sorry to tell you. It's us. We're going to do it on our own. And so we want to model for other corporations. And I see it already, that people have copied. Okay? There's some other people out here, I ain't going to say no names, but there's some people out here who've seen the initiative. It's like, we want to do that too. And so that's what it's about. It's about modeling what's possible, designing it, putting resources behind it because it's about money. We need money to save lives, right? So I'm thankful to Carol's daughter for this, and I'm also thankful to Higher Heights for highlighting the importance of the conversation for Black women because we need this. We need to know that our electeds care and that they are pushing our issues to the top of the agenda.
Well, thank you to Latham Thomas and Lisa Price for sharing your story today and sharing your story of the delivery of love through Love Deliver.